Thank you, Presiding Officer. I'm pleased to have this opportunity to speak in support of the motion MS Awareness Week in the name of Paisley's MSPs, George Adam and Stacey Adam. I've added that because George said that was the case. My first written assignment on my first placement as a nurse 35 years ago when I was a student was to write a care plan essay. And I chose to write about a woman who had a diagnosis of multiple sclerosis. And I clearly remember this smart, bright and feisty woman in her 40s. And I'll call her Frida to protect her confidentiality. Frida was confined to a wheelchair, and when I met her, she needed assistance with many of her activities of daily living. Her personal hygiene, putting on clothes, assistance with meals, and her mobility, which was absent, so she was unable to transfer from her bed to chair and back. But what I do remember clearly is her competent ability to talk. And in fact, she helped me. She taught me how to provide care for her, which led me to provide the care for others for the next 30 years. She taught me about comfortable positioning on vulnerable heels, elbows and her bahuki. That's her words, not mine. She guided me about how much food needed to be on the fork or the spoon to avoid me choking her, and because she had a difficulty swallowing. And she did all of this with a kind approach and a sense of humour. And we also talked about her MS and the need for research, and this was 35 years ago, the need for research into the causes, treatment and a cure. So for the remainder of my contribution, I would like to focus on research and the positive steps which are being taken to identify the cause of MS so that we can determine and treat people with improved drugs and aim for a cure. And I'd like to thank the MS Society and all of the researchers and funders for their contributions for the research to actually take place. MS does affect 11,000 people in Scotland. It's often painful and exhausting, and it can cause problems with how people walk, how they move, how they see, how they think and feel. And it can be unpredictable because the symptoms are different for everyone. The Scottish Government commits £500,000 to NHS Research Scotland Neuroprogressive Network every year to promote a culture of clinical research in neuroprogressive conditions, including multiple sclerosis, to improve recruitment to high-quality studies from both urban and rural areas across the country. And through the Future MS study, the Scottish Government has also invested almost £650,000 in a Scottish-wide study collecting clinical data and samples from 440 recently diagnosed relapsing onset MS patients. Additionally, the Scottish Government funds the Sprint MS PhD programme for 3 PhD studentships in MS, led by Professor Chandran at the Edinburgh Centre, and others have mentioned that as well. Overall, there will soon be 13 of these PhD students for neurodegenerative disease in Scotland, funded through a contribution of £430,000 over 5 years from the Scottish Government. Presiding Officer, over recent years, this research mentioned by others across chamber has allowed clinicians and patients to discover the success that chemotherapy can have in reducing relapses and potentially supporting remission. When people hear chemotherapy, they tend to instinctively think cancer, and that can be scary. But chemo has given MS patients it's proven to slow the progression of the disease, and it's this immunosuppressive agent and research that has shown it can help suppress any activity. So it's also interesting to read about other specific research like the remyelination, identification of biomarkers and susceptibility genes. And I'm also interested in exploring opportunities of Sativex, which is the first cannabis-based medicine to be licensed in the UK. And it has been found to help reduce muscle pain and spasm when a person has shown inadequate response to other treatments. So I'd be interested to hear the Minister's response related to Sativex and how it could be expanded potentially across Scotland. Again, I'd like to congratulate George Adam on securing this debate and reaffirm the importance of research that would no doubt have helped Frida and many others still to receive help across Scotland. Thank you.